Most people glance in the mirror every morning, but almost nobody looks closely at their tongue. And that's a mistake, because your tongue is more than just muscle for eating or talking. It's one of the earliest warning systems for deadly diseases inside your body. I am Dr. Alex Thorn, and I've seen patients ignore a simple change on their tongue, only to later discover it was the first sign of anemia, diabetes, even cancer. If your tongue has changed color, shape, or texture, it's not just random. It could be your body's way of shouting for help, long before blood tests or scans show anything. In this video, I'll show you exactly what your tongue is revealing about your health, and why ignoring it could be the most dangerous mistake of your life. Stick with me, because the difference between noticing and missing these signs could literally be life or death. Let me share a story with you. John, a 44-year-old teacher, lived a normal, busy life. He brushed her teeth twice a day, never smoked, never drank. But one morning, he noticed something odd. Her tongue looked unusually pale and had small cracks running across it. He laughed it off, thinking maybe he was just dehydrated. Weeks went by, and John began to feel more tired than usual. He blamed it on long work days and stress, but what he didn't know was that her tongue was screaming for help. Those cracks and that pale color weren't harmless. They were the earliest signs of severe iron deficiency anemia. By the time he finally went for a checkup, her iron levels were dangerously low, and her doctors told her he had been only weeks away from a health crisis. John was shocked, because the only sign he had all along was on her tongue, a sign he ignored. Now let's step back for a moment. Why does the tongue reveal so much about your health? The answer is simple. Your tongue is covered with thousands of tiny blood vessels, nerve endings, and taste buds that depend on proper blood flow, oxygen, and nutrition. When something in your body is off, whether it's your blood, your heart, your liver, or even your immune system, your tongue is one of the first places where the imbalance shows up. That's why doctors in traditional medicine, as well as modern hospitals, often check a patient's tongue as part of the exam. A pale tongue can mean anemia. A bright red tongue can mean vitamin deficiencies. A purple or bluish tongue can signal heart or lung problems. Even swelling or grooves can point to thyroid issues. Your tongue is like a mirror, reflecting the silent changes inside your body before they become full-blown disease. Now let's break down the most dangerous tongue changes you should never ignore. These aren't cosmetic issues. They're your body sending distress signal. 1. Pale tongue. A tongue that looks unusually pale can mean iron deficiency anemia. Without enough red blood cells, your body can't deliver oxygen, leading to fatigue, weakness, even heart strain. If you see this, it's a red flag to get your iron levels checked. 2. Bright red, glossy tongue, sometimes called a beefy tongue, often linked to vitamin B12 or folate deficiency. Left untreated, it can lead to nerve damage, memory loss, and long-term brain problems. 3. White coating on the tongue. A thick, chalky white film is often a sign of fungal infection like oral thrush. But in some cases, it points to weakened immunity. Your body can't fight off infections the way it should. This is especially dangerous for people with diabetes or those on immune-suppressing medications. 4. Purple or bluish tongue. This is one of the scariest signs. It often means your heart or lungs aren't delivering enough oxygen to your blood. Conditions like chronic heart disease, COPD, or blood clots can show up this way. 5. Swollen tongue with grooves or indentations. A tongue that looks enlarged with teeth marks or grooves on the sides can signal thyroid problems or severe allergies. In advanced cases, swelling can interfere with breathing, an emergency situation. Let's go back to John's story. For weeks, his pale, cracked tongue was the only visible clue that something was seriously wrong, but John kept ignoring it. He thought it was just dehydration, or maybe stress. By the time he finally went to the hospital, doctors told him his iron levels had dropped to dangerously low levels. His heart had been working overtime just to keep him standing. If John had taken those changes seriously the first time he noticed them, he could have avoided weeks of fatigue, risk of fainting, and the possibility of permanent damage. The truth is, our bodies rarely stay silent. They whisper first, and when we don't listen, they scream. The tongue was John's warning sign. It could be yours too. So here's what I want you to do. Today, not tomorrow, go stand in front of the mirror. Stick out your tongue. Look at the color, the texture, the coating, the shape. If something looks unusual, pale, bright red, purple, swollen, or coated, don't ignore it. This might be your body's first warning sign of something much more serious. Your tongue isn't just there to taste food. It's a window into your health, a signal system designed to protect you. The earlier you notice these changes, the faster you can act, and in many cases, prevent life-threatening diseases from progressing. Don't wait until it's too late. Take your health seriously. And if you found this video helpful, share it with someone you care about. It might save their life too. I am Dr. Alex Thorn. Stay aware, stay healthy, and I'll see you in the next video.